Most of the time, kidney disease is silent. It does not talk, it does not speak, it does not shout. You have to go looking for it. Once kidney disease starts, it is like a train. You can only slow the speed of the train. You cannot stop the train from reaching the end point. Just taking her regular medications, going about life as usual, feeling normal as one normally does. And suddenly one fine day she started noticing that she had some swelling in the legs. Borderline high creatinine or a creatinine which is not alarming does not mean that the kidney health is all good. It is not good. We need to wake up and smell the coffee. Bacterial infections, even viral infections like dengue, malaria or the parasitic infections also cause a large impact on the kidney and we see a lot of kidney injury along with that as well.
Dr. Ruchi Samdani, thank you so much for joining me on my show. And for people who don't know, you're one of the leading nephrologists of the country. You don't seem it because you look so young, but you do have years of experience. Let's start with how prevalent kidney disease has now become as a disease in India and worldwide.
Global concern. In the year 2000, there was 1 in 10 individuals who had kidney disease. The numbers increased over the next 10 years. In 2010, there was 10 to 12% individuals worldwide. It was becoming a public health concern. And in 2020, the numbers have increased to a staggering more than 650 million people are currently affected by kidney disease. So it is a global epidemic.
Yeah.
Now let's look at the numbers in India. Currently, we have more than 150 million people who are affected by kidney disease. The numbers in 2000, if we look at it, we don't even have that much data. People were mostly detected very late. Most of them had end-stage kidney disease. But however, in the last 20 years, it has increased tremendously. So we have a huge burden of kidney disease, both in India and worldwide.
And what would you say the average age is for this to occur? Or to start showing signs?
So the age for first starting to show signs would be in the 30s. I would say between the 33rd and the 5th decade would be when first signs of kidney disease would start showing up. That has a lot to do with the underlying etiology. What are the cause of the kidney disease? Okay.
Yeah, so that's my point, right? So one of the reasons I wanted to do a session just on this,
right.
Of course, I've done something on heart as well, is because it's an amalgamation of lifestyle diseases, right? So it doesn't actually occur in a vacuum.
Absolutely correct. Kidney disease does not occur in a vacuum. It is a consequence of lifestyle disorders like diabetes, hypertension, obesity. All of these conditions, when left unnoticed, untreated, unattended to, eventually lead to kidney disease. So it is not that kidney disease suddenly shows up. It shows up when these other chronic medical conditions are left unattended, and we do not also screen for kidney disease.
Also, let's just dial back a little bit. When you talk about kidney disease, what does it mean?
So kidney disease is a structural or functional abnormality in the kidney. It can manifest in the form of decrease in the filtration or in the form of protein leak in the urine. The earliest signs which someone may manifest with would be swelling in the kidney, in the lower extremities, in the legs. Most of the time, kidney disease is silent. It does not talk, it does not speak, it does not shout. You have to go looking for it. So kidney is a filter. So it is responsible for filtration of all the toxins. You can actually think of it like a water purifier which we have. When your water purifier is functioning well, all your toxins are released and you get clean, pure water. The moment our filter starts getting clogged, the toxins remain behind and the quality goes down. So it's absolutely the same analogy to the kidney as well.
Yeah, that's a great analogy but what's fascinating is that the sort of filtration process of the kidney is impacted by high sugar, high BP. I mean, how does that work?
Hypertension and diabetes impact the kidney because they cause hyperfiltration injury. It causes injury to the individual cells, the nephrons, which is the individual filtering units of the kidney, they get impacted, and hence the filtration starts going down.
Okay, I understand. And in a country like India, diabetes is one of the leading, it's a country which leads in diabetes. So is hypertension. Hypertension is essentially high BP, blood pressure.
Yes,
Right?
absolutely. So India is actually the diabetic capital.
Yeah.
Right. I mean, the amount of sugar elevation that we have, it is a lifestyle disorder because of food, because of sedentary lifestyle, disorder which is also genetic in origin. So we have a large number of people who have a genetic basis also for diabetes, and hence cutting the sugar content in your diet, keeping a close watch on what you're eating makes a lot of difference in the way the diabetes and hence the other end organs are also going to get affected.
In packaged goods.
Absolutely. I think packaged goods are the number one reason for metabolic syndrome currently. The amount of sugar, the amount of hidden salt which is there in packaged food is definitely responsible for these lifestyle disorders. And we as Indians have got this, there is a fast food craze which is going on. You know, people are just consuming without thinking. We do not have the awareness to look at the labels. We do not have the awareness of eating healthy, and I think that is something right from childhood it needs to be inculcated, and hence we need to curb these lifestyle disorders.
Yeah. And hypertension.
Hypertension also, absolutely, because of the salt content which is there.
Okay. So hypertension is directly linked to the salt content?
Absolutely. There is an entity which is called essential hypertension and salt sensitive hypertension. So hypertension is one of those disorders which the more the salt you consume, the higher the chances of the pressures going out of control. In a country where we are consuming large quantities of packaged food, processed food, all the hidden salt which is there in your sauces, papad, pickle, farsan, namkeen, snacks, gathia, fafra, everything that we consume is so high in salt. So we need to cut down all of that so that we are able to cut down the degree of hypertension that is there, keep the pressures under control, because medications alone cannot cut it. You have to control your diet.
So diabetes and hypertension, let's say in theory, can be controlled.
Yes, yes.
Correct? However, when you have the onset of kidney disease, that is one disease, even unlike cholesterol and the heart, where there's a statin, where there's a stent. I mean, of course, you have dialysis for chronic kidney at the later stage, but I'm saying otherwise, you can't actually stop kidney disease or control it too much once you have the propensity for it.
Yes, once kidney disease starts, it is like a train. You can only slow the speed of the train. You cannot stop the train from reaching the end point. However, with lifestyle, with medication, you can definitely slow the speed and decrease the decline and the progression of kidney disease. So definitely it is important. That's why it's even more important to screen, to detect early, so that you can, as soon as the first sign of kidney disease comes up, you have to start treatment immediately.
What are the signs? Like, what do you screen for?
So the two most important and most easily available tests are the blood test, which is for the serum creatinine level, which is a measure of the toxin levels in the body, and the second is a simple urine routine microscopy. That is a test which tells us about the protein leak. So how are the kidneys filtering the protein? So these two markers at least give us a window into the kidney health, and we should screen for them regularly, especially in patients who have diabetes, hypertension, or risk factors for kidney disease.
When you say protein leak into the urine, what does that mean exactly?
So the filtration units of the kidney are such that all the blood gets filtered via the kidney. The protein should be left behind in the blood only, and the pores should restrict the entry of the protein into the kidney, into the urine. Patients who have kidney disease, the pores become big. The sieve is not intact, and hence protein, which is a fairly large molecule, starts seeping into the urine. That is one of the earliest markers of kidney disease. And we
So you're
should,
saying essentially the pores of the sieve.
yes, the
It's like
pores
if
of
you're
the
if you're
seeds,
actually
absolutely.
filtering masala chai and the
Yes,
masala is
yes.
on top, those holes become larger
and
and then allow the protein
to leak
and that's one of the indicators.
of kidney disease. One of the earliest signs of kidney disease is urine protein which becomes positive.
Okay. And the serum creatine that you're
Right,
talking about,
right.
the normal range is still about 1, right? 1.2.
Varies between labs, but usually between a 1.1 or a 1.2 would be most of the time upper range.
But should you have 1.1? Is that an okay, or should you
So creatine
ideally be
also
lower?
depends a lot on your body mass. It depends on your body mass, about on your height, weight, amount of muscle you have, because it is a protein. It is actually a waste product from the muscle. So patients who are very well built, people rather who are very well built, they have a large amount of generation of creatine, and they may have a normal kidney function, but they may have a slightly on the higher side of creatinine because their generation is very high. Does not equate into having kidney disease. So
that's interesting.
Yes. So the creatinine, we have to see. We don't see one number only. We have to see it in totality of who we are dealing with, what we are dealing with.
And also, when the body undergoes a sort of viral or a hit, like a high intensity infection, also your kidney can take a hit, right? Like,
Absolutely.
And that can be temporary.
So there is an entity called acute kidney injury, where the kidney is at risk for a temporary decline in the kidney function. This can happen because of severe dehydration, because of certain infections, uh, and this kind of kidney disease is reversible.
So when when there is injury to the kidney out of an infection,
Right.
Usually it reverses.
Usually it reverses.
But you have to be careful at that time.
You have to be careful at that time.
Yeah. How do you, once you're diagnosed with slightly elevated creat, or there is some protein leakage, now you know your body doesn't have a ideally functioning filtration process.
Correct.
And there is, your body is retaining more toxins than it should and more fluid than it should. What's the next step?
So the next step needs to be, we have to find out why that's happening. Okay, what are the controllable factors, modifiable factors, and take action immediately. Take action immediately. I'm going to tell you a little small story about a patient. Her name was Mona. She was a 46-year-old teacher. She had diabetes and hypertension for many years. She was taking her regular medications, going about life as usual, feeling normal as one normally does. And suddenly, one fine day, she started noticing that she had some swelling in the legs. She ignored that for a while, contributing it to just being tired. And then at one of the health camps, we did her urine test and her blood test, and to her dismay, her creatinine levels were elevated. There was a protein leak in the urine, and I diagnosed her as chronic kidney disease stage 3. So this was a life altering event. I mean, this changes the way you live, the way you function. And this is something which really got her thinking. I was in my medical college that time, and got me thinking, and got that awareness is so important. This could have been picked earlier. We could have picked this up early. She would not have progressed to a stage 3 chronic kidney disease. Her life could have been absolutely different. When you're at the stage 3, it is imminent, inevitable that you are going to progress. So there are 5 stages through which the kidney disease progresses: stage 1 through stage 5. Stage 5 is when you are almost going to require dialysis, or you are going to require dialysis. Stage 1 is when it is very early pickup. So we always, as nephrologists, I think the biggest thing would be awareness that we can pick kidney disease up at the stage 1. We should have so much awareness that people are screening for it. We should be able to pick it up early, and then they don't progress to a stage 5. We take action at stage 1 and stage 2, the chances of progression to stage 5.
What would the action be?
So the action would be, if there is an elevated creatinine, or if there is protein leak, we need to act on it. We need to start them on medication and lifestyle changes, dietary measures. Diet is not only a way of life in kidney disease, but it is also therapeutic. It alters the way the kidney is going to shape. So it is extremely important to start taking note and start taking action right there. When you are at a stage 1 or a stage 2, you should take action at that point.
So basically, control your salt and have a diet that is renal friendly.
Absolutely. So it's about definitely controlling salt. The sodium intake should be limited to less than 2 grams of a day. It's not only the salt which you add with the salt shaker, it is the hidden salt that needs to be taken into account. All your salt which is there in your papar, pickle, farsan, namkeen, gathia, your sauces, your soya, all the Chinese food, all that is all hidden salt. You have to take that into account as well. All the processed food, all the processed cheese and butters which is salted, the Amul butter extremely salty, should be taken into account. Okay.
Yeah.
The second thing which is also very important is protein restriction. So, which brings me to a point that in kidney disease, we recommend protein restriction, not protein depletion. Somehow there is this huge advisory board which is outside the medical community, which is advising that you should completely cut down on protein. And as it is on a vegetarian diet in the Indian subcontinent, the protein intake is very restricted. So, protein depletion causes malnutrition. Protein is required for muscle, it's required for cell repair, it's required for immunity. So if you cut down the protein completely in a patient who has chronic kidney disease, you are going to actually do a disservice to them. So you have to restrict your protein. The amount of protein you take varies as you go from a stage 1 to a stage 5. And it is as per your body weight. There is not one size fits all. You have to personalize it for the patient. Also, protein which is high in biologic value should be taken. Higher biologic value protein means protein which has all the essential amino acids, and it can hence be consumed and used.
So not plant protein.
So plant protein like soya has got the essential amino acids and is high biologic value. Dairy and milk is high biologic value, can be consumed. In the non-vegetarian part, fish, meat and chicken are also high biologic value. So we need to restrict the protein as per the stage, consume protein but not deplete the protein reserves from the body.
So like, let's say someone who has chronic kidney disease, stage 1 or 2, is 50 kilos.
Correct.
Now, typically the advice is, if you're fairly active and working out and reasonably fit, the protein intake should be as per body weight or higher.
Correct.
Okay. But in a person with kidney disease, it should be how much?
So approximately if the person has a stage 1, stage 2 kidney disease, the protein intake should be around 0.8 grams per kg per day.
Okay.
And the protein restriction then continues as you progress from a stage 2 to stage 3, 4, 5.
And it becomes less.
It becomes
let's
lesser.
say 0.8 becomes
0.7, approximately 0.7.
But then what? So then a person who has chronic kidney disease should ideally not do high intensity workouts, because the more high intensity of workout, the more protein you actually need, right?
Yeah, that is a really good point actually. That definitely with the high intensity workouts, you do need
like if you're strength training a lot,
absolutely
3 to 4 times a week.
Yes.
Let's say someone like me, right? Like
Correct,
I'm perimenopausal.
Right.
And the highest level of sort of control that I've been told for bone density and muscle and all that is strength training.
Absolutely.
But then I've been told once I do that, I must consume high level of protein.
High level.
But what if I had chronic kidney disease then?
So then definitely you will have to limit your protein intake. I mean
so then therefore limit the workout.
Yes. There you will have to limit the workout in a I would say justified in fashion. We have to be a little careful about the workout because we cannot overburden the kidney with protein. It leads to hyperfiltration injury, and so we should be judicious about it.
What about people today who are taking protein as per the recent guidelines, which is sort of 1.5 1 times body
Correct,
weight,
correct.
etc.
1 to 1.2 grams per kg per
And are
day.
doing the whole protein shake thing
Yes,
every day and
yes,
all that.
yes.
Is that safe for your kidney? Like, does that add addition? So look, protein shakes, which give you that amount of protein in one glass,
Correct.
is that safe for the kidney?
So, we've seen a lot of patients coming in, young people who are taking protein intake of up to 2 grams per kg per day. So, they are on a large amount of protein intake. They have a lot of the shakes and a lot of protein supplements. We see a lot of kidney injury with that. We see a fair amount of kidney injury with the supplements, and hence I usually don't I would not recommend unjudicious intake of protein supplements to such people or to most people who are consuming such high levels of protein.
So you see injury in those, in
Yes,
some
we
of
see
those, which means it can be reversed.
it can be reversed. Most of the time, it can be reversed. Some people who have risk factors for kidney disease, maybe they could be genetically predisposed to kidney disease. Their kidneys are more vulnerable for injury, and many times, if the injury goes unnoticed, like it does in many times, most cases it does, then it can progress as well.
Is this a genetic disease, or is it that diabetes and hypertension is genetic, so therefore it converts to kidney disease?
So that's a really good point. So there are two types of kidney diseases. One which is the lifestyle diseases, and the second is the genetic. So when there is a problem in the genes, the way the kidneys develop is altered, and usually they manifest much earlier. So we see that in the pediatric age groups thing, and these patients definitely then their kidney disease most of the time progresses, like the polycystic kidney disease. They have Alport syndrome. There are a variety of syndromes which are genetic in origin. Having said that, patients who have diabetes and hypertension with a genetic risk factors for kidney disease, also they progress faster. Just to give you an example, like there can be two diabetics with similar control of their sugars, similar control of their pressures, but one may progress to a kidney disease, one may not. So that brings us to the point that genetics does have a role to play in kidney disease progression as well.
Okay. But if there's good control on diabetes and hypertension, the likelihood of that is lower.
Much
Even if
lower.
you're,
Absolutely. Even if you have the risk factors, you can control it.
okay. What are the risks with chronic kidney disease? Like, how do your other organs get impacted, Ruchi?
So chronic kidney disease is actually, as I said, it doesn't happen in a vacuum. Because it doesn't happen in vacuum, it impacts every other system of your body. Whether it is the cardiovascular system, the brain, the bone health, everything is impacted. So let's start from head. We can go from head to toe actually. It affects your brain, it affects the functionality, the dementia risk sometimes increases in patients. You are more prone for heart attacks. Definitely cardiovascular health goes down. Your bones are impacted. You are higher chance of osteoporosis, fractures, falls. The gut is affected. It changes your menstrual cycles. Fertility gets impacted in both in men and women. Anemia, your blood levels go down, definitely leads to weakness, less oxygen in the body, in the circulation. So it is impacting every system in your body. It goes for a toss the moment kidney disease starts setting in, and even more as it progresses. So most patients with kidney disease are at very high risk for a cardiovascular event, especially heart attacks or heart failures.
So, if you already have a vulnerable heart, it becomes even more dangerous.
Absolutely. Your chance of getting of heart attacks or cardiovascular events increases manifold.
Okay. And actually, it's not really talked about, right? Nephrology. It's
Yes.
considered to be a bit of a stepchild in the medical industry because it's not a larger than life disease the way cardiology is, or perhaps it doesn't have as much money going into it. like the cost of a
Yes,
stent or the
yes,
cost of a
absolutely.
bypass.
Yes,
You know,
yes.
let's face it.
Yeah.
You know, these are very high-profile diseases.
I think it is one of the most underdiagnosed and under talked about diseases. The awareness needs to increase, and I think marketing has a lot to do with it. You're absolutely correct about that.
Because the money in it is not enough.
Is not enough.
Except for, okay, control the progression.
Correct. I think one of the other things also is that, you know, chronic kidney disease is really, it's one of those things which is just, if you see a borderline or a slightly high creatinine, just pushed under the carpet. That is nothing to do. It's fine. Don't worry about it. It'll come under control. Till and then slowly a point one increase in the creatinine level is when the kidney injury is happening continuously. So we should take note. That is the time when we need to get up and smell the coffee.
Yeah.
That it is an important, irreversible damage which is going on in the kidney. We should take note of that. And that is the reason the World Kidney Organizations, a number of organizations which we have, decided to put EGFR, which is the estimated filtration rate, onto every investigate creatinine reports which we now have. That is a reason to bring awareness that a borderline high creatinine or a creatinine which is not alarming does not mean that the kidney health is all good. It is not good. We need to wake up and smell the coffee.
But tell me, what is the filtration rate? This
So
EGFR.
the EGFR is the estimated filtration rate. It tells us about how the kidneys are filtering, which is the basic work of the kidneys.
Yeah.
Right? The normal filtration rate should be 75 to 100. And post the age of 40, the filtration rate declines because as all other organs, the kidneys are aging as well. It can be measured, and it is a calculated value as well. Because we wanted to raise awareness as a community, as globally, because of the increasing rise in the burden of chronic kidney disease, we decided that EGFR should be there. We should take note. And so many times now I have patients coming in only because of an altered EGFR, not so much concerned about the creatinine, but because the EGFR is altered.
But as you age, does it naturally go down anyway?
It naturally also goes down.
Which means like people, you know, they go to the loo less, like
So it may not necessarily translate into less urine production, because there are a variety of different kinds of kidney disease. One in which your urine output goes down, the others the concentration ability goes down, the third the protein leaks. So it totally depends on what kind you have. But because of the aging population, because of the increase in the geriatric population, also chronic kidney disease prevalence is increasing. So most of this 80-year-old.
So as the population sort of ages,
that's what
you'll see the occurrence of this disease more.
Much more as well.
Yeah.
So they may not have a chronic creatinine levels which may be very alarming.
Yeah.
But they may have a creatinine levels which may be 2 or 2.2. You know, nothing out of the ordinary, nothing very alarming. But definitely the aging process also has a role to play.
Okay. Tell me, when there's COVID, when there was COVID, so there were some people who got COVID, they never had kidney disease before, but it ran in the family.
Right.
Did you see any correlation between the occurrence of COVID in these kind of patients and it's sort of translating into this now starting in the body or reflecting in your blood tests?
So actually, that's a really good point also, Devna. During COVID, there was a lot of antigenic responses which we see. So kidney disease is also linked to a lot of autoimmune diseases. And post-COVID, we have seen a large increase in the number of autoimmune diseases, manifesting in the form of increased creatinine, protein leaks. Also, post-COVID or during that time, because of the aches and pains in the body, there was an increase in the consumption of painkillers. There was a large number of painkillers people used to consume. And that also has now translated into an increase in the chronic kidney disease prevalence in those patients and patients who had risk factors or were predisposed genetically or otherwise for kidney disease.
So painkillers put pressure on the kidney.
Absolute painkillers. there are two types of painkillers.
Yeah.
There are the good ones,
Yeah.
which are safe for the kidney, and there are the toxic ones which definitely should not be taken.
Which ones?
Like all your flams, like your combiflams and your brufens, ibuprofen, extremely toxic for the kidney. Should not be taken. Should be taken judiciously, if at all. Usually during the 20 to the 40-year-olds, that's the maximum. That's the period when patients are consuming it very often, or the 60s with the osteoarthritis. Consumption of painkillers is very high. By the time this kind of kidney disease is 100% silent, you will not come to know about it till the kidneys shrink. They become small in size, absolutely irreversible. And then if we look back, we see the correlation between the painkillers and the kidney disease.
What about diabetes medication like the metformin?
So diabetic medication is not nephrotoxic at all. It would, if anything, it would prevent the progression of kidney disease because it's
You're
controlling
controlling the sugar.
the primary factors.
What about medications to control other things, statins for cholesterol? Are there any other medications apart from painkillers that are a risk to the kidney?
So there are certain Ayurvedic medications, of course, which are big no-no. They contain a lot of heavy metals, so we see a lot of kidney disease because of that. Certain antibiotics are also toxic to the kidney, should be taken judiciously under supervision. Most of them are injectables, should be taken carefully. Like the aminoglycoside group of antibiotics should be taken carefully. So we have a whole bunch of medications.
In layman terms, your Augmentin, Aziz and all
they are all good. They are
okay.
good.
What about steroids?
So steroids are not toxic for the kidney at all. If at all, steroids are utilized for multiple kidney diseases.
Okay.
We utilize it for autoimmune diseases, sometimes even for allergic nephritis and inflammation in the kidney. We utilize steroids to reverse the kidney injury.
That's the other point. Inflammation. Okay, so that's again become a buzzword, you know,
Correct.
inflammation in the body.
Right.
How you just talked about chronic inflammation or inflammation of the kidney.
Right.
How does that happen?
So inflammation actually is one of the very important points also, which causes a fair amount of kidney disease. We see it with a lot of medication which can cause low-lying inflammation. Tuberculosis causes low-lying inflammatory processes in the body. Certain chronic infections, patients have diabetic foot, they have low-lying infections, also impacts the kidney by causing secondary diseases. So inflammation is an important marker which we always take into account when we're looking at kidney disease as well.
Okay. And is swelling in the feet and swelling in the calves and all that, is it a pretty reasonable indication that your kidneys aren't working well?
So it is an important marker. It is one of the few signs which we have for an earlier manifestation of kidney disease. When there is swelling and edema in the feet. Sometimes another important marker is also when you have puffiness on the face. You get up in the morning and your eyes look puffy.
Yeah.
And as the day progresses, the puffiness goes down. So that's another early marker of protein leak and hence of kidney injury which is going on.
Okay. But what about perimenopause and menopause? You have all these symptoms, Ruchi. So then how do you, like, for example, like my feet feel swollen in the mornings.
Right.
You know, which is something I feel puffier than.
Correct.
So how do menopausal women and perimenopausal women then sort of, these are all the signs.
Yes. So we have to screen. We have to be very vigilant. We have to check the creatinine levels. You have to check the urines.
Yeah.
And anyway, post-menopause, we should take into account the cardiovascular risk which we have, and tests should be done regularly.
Yeah. So how often should you screen for kidney disease? Once a year?
Annual screening definitely is recommended. Anyone who is diabetic, hypertensive especially, if they have any signs of any of the early signs like swelling or facial puffiness, should be screened even biannually.
Because even the brain fog that comes with as your disease progresses, because your brain does get cloudy. Huge factor in menopause.
Yes.
Literally brain fog is a part of it.
Yes.
So, basically nothing goes women's way as they age, except for the fact that they don't give a damn about other
That's
people and what people think. Apart from that, physically it's all bloody downhill.
Yes.
Anyway, but jokes apart, I mean, children, right? Like we think this is a disease that doesn't impact children, and for the most part, it does not and occurs later in life. But what do you do now when you have teenagers and they're eating out and they, consuming junk food and there's so much salt that's going into their bodies? Like, what do you do with kids and teens particularly?
So I think definitely the growing epidemic of obesity in children is something that we need to look into, because the obesity by itself is a very high risk factor for kidney disease.
Why?
Because obesity causes a lot of pressure on the individual filtering units. The pores become big, they start leaking protein as one of the causes. Otherwise, obesity by itself leads to metabolic syndrome, diabetes
Yeah,
risk increases,
of course.
hypertension risk increases, and hence you're getting into the whole lifestyle diseases. We should definitely be very vigilant, and we have to cut down the intake of processed food for even for the kids.
Yeah.
We have to make them aware from now. So there's a study which was the DASH diet, which is a diet which was recommended for patients with hypertension. Low salt and high fresh food, plant protein intake, and they found that these patients had a better control of pressures. So definitely controlling your salt intake, eating plant protein in the form of fresh fruits, vegetables, fresh fruit is what should be recommended, and that is the only way out for kids, because what we do to them today is going to impact how they are going to live for the next 5 decades.
What is the average amount of salt an adult should have?
So the average amount of salt, the sodium intake should be less than 2 grams
A day?
a day.
But what
or
about the
3
salts you're
grams.
losing in sweat and things like that?
So 2 to 3 grams of salt should be sufficient. So I did a study actually a couple of years ago on a couple of patients, and who were saying that they consume very less salt. And what I found out based on the urine studies was that they were consuming, when they said they were hardly consuming anything, they were consuming 8 to 10 grams of salt a day, which is a fair amount of salt to be taken. And these were patients who had a good kidney function, or borderline kidney function, I would say, and they were on a low salt diet. So can you imagine the amount of salt that we are consuming when we are having a full diet, which is full of our various sauces, pickles, and all the additives that we have? So we should be very judicious in the amount of salt we take.
So that's the number one factor, right?
Absolutely.
Salt is basically the number one factor.
Salt is the number one factor. There's a very important concept called metabolic memory. So our body cells have a metabolic memory. What you do today impacts what is going to happen and how your cells are going to behave even later on in your life. And that metabolic memory, if you start consuming low salt, low sugar, whether you're a diabetic or a non-diabetic, definitely has an impact on your metabolic profile going forward in life. And that is what we have to target for our kids. That is where we have to target for our kids, to make their lifestyle such that they consume less.
So your own household, how much salt do you?
So actually, we usually don't consume much salt at all. We make our food without salt, because as it is going out and eating out, a couple of times, we'll end up eating salt. You have your bread or you have your butter, you are consuming that hidden salt. So the fruits, vegetables we make without salt, and that's how we would like.
So when you cook at home, Ruchi, you're saying you're not putting salt at all?
We don't put any salt in our food. And we just, because we are having the additives along with that as well. I mean, you're having your toast with your butter in the morning, and you're having your other sauces or pickles. So you are kind of balancing it out. If we have full plate full of salt and you are having all of these additives, so it amounts to a large consumption of salt.
And also then, but you have to also have enough salt, and that's one of the tests for that is your electrolyte test, right? Like where your measuring.
Yes, yes. So I would not recommend having a no salt diet for anyone.
Yeah.
I mean, we are able to kind of balance it out with the salt in the food, which is freshly made at home, and what we eat outside. But definitely having a low salt, meaning 3 pinches of salt or 4 pinches of salt is more than adequate in a
In a
day.
day.
In a day
And
for
iodized salt, right?
and iodized salt. So there's a lot of fat about pink salt, Himalayan salt.
Yeah.
Well, is that good? So the sodium content is the same, but we have seen that some traces of potassium in that salt. So definitely I would not recommend it from the kidney standpoint. For anyone who has a propensity for kidney disease, I would recommend you just take the normal Tata iodized salt. That is good, cheap, inexpensive, and it does the work.
Yeah. And they come in those 1 gram
Sachets also. So just easier to consume, easier for you to calibrate as well.
Yeah. Also, Ruchi, post-COVID, one is seeing the sort of I don't know whether it's related to COVID or not, but the virals, the infections have been sort of fairly intense. Recovery process is slower from infections across the board. Does that pose a threat to your kidney?
Definitely, absolutely.
For no fault of your own.
For no fault of your own, we are seeing a very high increase in the post-infectious nephritis, which is the post-infection injury to the kidney. Happens in all age groups. The kidney function declines. They develop hypertension as well. Very common, and we are seeing a huge insurgence of that. Whether this is related only to the infection or also along with the decreased immunity, something that we need to really look into. And but definitely post COVID, we are seeing a rise. Also, along with both bacterial infections, even viral infections like dengue, malaria, or the parasitic infections, also cause a large impact on the kidney, and we see a lot of kidney injury along with that as well.
And the thing is, even if it comes back and it recovers, the fact is there has been a temporary, fairly large hit from something like dengue, right?
Yes, yes. So if you have had an acute kidney injury, there is a higher chance that you're going to get it in future as well.
So then you have to start being very careful.
Absolutely. Your kidneys are vulnerable, extremely vulnerable.
Yeah. Okay, so today if I was to say, I've heard Dr. Ruchi Samdani talk about kidney disease and I need to sort of live a better life. Just give me 3 or 4 principles I should follow.
So I think very important things which going forward, which will help us, Devna, would be keeping a good lifestyle. Definitely, I again come back to the same point. Salt should be in moderation or restricted. Be aware of the lifestyle disorders. Keep them, once you diagnose it, keep it under control. Regular checkups. Do not go on to fad diets. No Chinese herbs. Cut down your intake of your painkillers. Have them very judiciously, and be aware.
So you know what? The other thing is, there are kidney transplants. Not always successful. And while people think this might be like a miracle, now I've got a new kidney, there's a long waiting list in India to get a new kidney, right?
Yes, yes, yes.
So people do it all over the place, different countries, etc., etc. Let's just say that they have access and they do it, etc. But the fact is that you have to be on an immunotherapy drug for your life, right?
So kidney transplant is a life-changing process. It is actually, I would say, a medical miracle. Any of the transplants is a medical miracle. This medical miracle started with Ganesha doing his head transplant, right?
And it really improved, because who needs a human when you can have an elephant?
Absolutely, right?
Yeah.
And kidney transplants have really evolved over the last 3-4 decades. And the success rate of kidney transplants, living donor transplants, which is most prevalent in India, is almost 95 to 98%. Patients do very well. They have to be on immune suppressive drugs lifelong. The degree of the immunosuppression also declines with time. The maximum is in the first 3 months, and as the body accepts the organ, the doses of your medications also starts going down. Having said that, I think it is the quality and quantity of life with someone who does a kidney transplant is far superior than dialysis. So it is the way to go for someone who has end stage kidney disease.
And what's the age limit at which you should get that transplant?
So there are two types of kidney transplants in the living donor as well. You can do it once you're on dialysis, and there is an entity called preemptive transplants, where before you go on to dialysis, you can straight away go in for a transplant without going through dialysis at all. Many young patients are now opting for that. So they know that they have chronic kidney disease, they see it progressing, and when they're at stage 4 and 5, we already start counseling them and talking to them about transplants, and they're ready for it. Yeah. And they do it preemptively. So all the side effects or the burden of diseases that comes with dialysis, they are able to forego all of that. They are able to have a normal good kidney function, and they're able to have a longer lifespan. Definitely the quality and quantity of life on a transplant is superior to that on dialysis.
And what age
so the usually more than 70, 75, usually we don't do transplants, but I've done it on even a 75-year-old who's been extremely healthy. So age may be relative, but definitely, I mean, it comes with its restrictions.
And dialysis obviously is the last stage and the last sort of resort that you have to do when you don't have a choice. So what is that stage? Basically, you've reached stage 5.
Correct.
Your filtration rate has gone down below 15 or 10%.
Look at you, you're all super intelligent.
Well, your job is at risk now, Ruchi. No, so I mean, this is basically the stage at which there's no slowing it down, and and now your other organs in your body are at risk.
Yes, absolutely correct.
But there's such a stigma in India, when people say, oh, now I have to get on to dialysis. So many people are like, oh God, now your life, there's that.
Whatever. I think that should change, because the quality of dialysis is improving, the medications are better, or rather, let me say the filtration processes are better.
Yeah.
Hence, patients who are regular on dialysis, they are unrestricted. They are able to go about their life as usual, barring the 12 hours they spend on dialysis. Apart from that, I think they lead a very good life.
Yeah.
So the stigma should go down. Patients should be aware, and they should actually go forward for dialysis in a more positive fashion.
Yeah.
There's a lot of
also look, when you're in your 60s doing dialysis, it's a huge pain, because in your 60s you're still working. You still have an active work life, travel life. Your kids are not that old. They're still relatively young. But I think when you start dialysis in your 70s and 80s, things start to change, where anyway your lifestyle and your life has slowed down a little bit. So it also depends on when you start it, right?
But patients, there's a flip side to that as well, because when you're 60, your overall other health is very good.
Yeah.
So you would do very well on dialysis.
Yeah. What are the risks of dialysis? So basically, essentially, dialysis is a machine acting as an external kidney.
Absolutely. Isn't that a miracle in itself?
Yeah, it is.
There is no other organ which has an artificial organ which is there available for you. Kidney is the only organ which has two artificial things. Dialysis, and you have an option for transplant.
Yeah.
So even if you reach end stage kidney disease, stage 5, you have two options for living. Either you do dialysis or you do transplant. The machine is made such that 12 hours does the work what your kidney is doing 24 hours, 7 days a week. Yeah. Only 12 hours of dialysis. Yeah. So studies in the US and even the West and worldwide have now shown that the more dialysis you do, the better it is, because it is a more regular removal of toxins. Yeah. And hence the cardiovascular health, bone health, neurological health, everything is much more
preserved. And actually your life, sort of quality of life improves, right?
Absolutely, it improves.
But what are the risks?
So the risks in dialysis, a couple. Firstly is the cardiovascular risk, because in hemodialysis, which is the most prevalent dialysis which is practiced in India, the blood is going out from your body, is getting filtered via the dialysis machine and coming back. So in that process, there can be a lot of hemodynamic changes, meaning the pressures can go up, the pressures can go down, risk of infections, allergic reactions, also possible during dialysis. Some people can get infections. So there are a couple of risks which are there.
What is the longest a dialysis patient has lived with you?
So I've had patients who've been, currently also there's a patient who's around 15 years on dialysis with me, and he's doing very well. He's doing very well, and he goes about activity as normal. And I think that's really keeps me going seeing him.
Yeah. And what is your oldest patient on dialysis?
My oldest patient on dialysis currently is a 94-year-old who's actually prepping for his birthday on in May, for his 95th birthday.
How fantastic!
Yes, every time he sees me in the hospital, he'll say, "Mogambo khush hua."
Also you're so charming. All your patients love you. My own father, it just lights up when you walk through the door because of your positivity. But I just feel that with kidney disease, also you're talking about the miracle of dialysis and transplant, which actually gives you either a new kidney or something that acts externally, is also kind of making up for the fact that your body cannot cope with it, even via medicines.
Absolutely.
As a disease,
yes,
right? So it was necessary for something like this to come about.
I completely agree with you. We have an option. Most of the time, their other organs are doing well.
Yeah.
They are very functional. Their brain is good. They're thinking right. Their heart is good. Their bones are healthy. Then I really talk to them heart to heart that are we ready to give up?
Yeah.
And we're not.
Yeah.
And hence, at least we have an option. It is not ideal. I'm not saying that kidney disease is ideal, but at least we have an option.
Tell me, do you think that AI and the advent of AI in medicine, which is, so robotics is different, where now robots are being used quite often and quite well in surgery.
Right.
But do you think that we're going to reach a stage with AI where it's going to become minimally invasive in terms of a transplant? Or do you see any sort of research being done where a medication can come about, the way there's a medication for diabetes,
right,
or hypertension, or like now an immunotherapy drug for cancer,
right.
How there's medication evolving for different diseases, lifestyle and otherwise. Do you see that happening for kidney? Is there research being done?
So there's a lot of research being done in the sphere of kidney diseases. A lot of stem cell research has been ongoing. A lot of research being done on a wearable kidney, artificial kidneys, so that you don't need to be plugged onto a machine 3 times a week. Still in infancy, but I'm sure in time to come we should get there.
Maybe between 5 and 10 years.
Yes,
you might see some
definitely
advancement.
We would see an advancement. We are using AI in technology in dialysis machines as well. There's a lot of talk going on, so that we are able to sense the filtration, the way the clearance is happening in the machines, the way the blood is getting cleared, to pick those things, the signs up early, so that we are able to prevent the pressure drops during dialysis. Lot of research going on in that. We are using a lot of robotics currently as well in the sphere of transplantation, both in donor kidneys, meaning removal of the kidney from the donor, and also in the recipient. So robotics is definitely the way to go forward. Good amount of a good robotic surgeon can really decrease the hospitalization and improve the recovery the patient will make post-transplant.
Yeah. So I'm not going to get into the different types of dialysis and stuff like that.
Right.
Okay, because that's a totally different thing, right? Whether you use a catheter or you use a fistula and all that. We've discussed this and all that, and the benefits and disadvantages and advantages of both. But the fact is, when you reach a stage that you need to get dialysis, I mean, it's advisable to just go ahead and get it done, so that your other organs are not at risk of being impacted, or like a major heart attack or things like that, or a stroke.
Yes,
Right?
absolutely.
And that is what the key role of dialysis is. And it can extend your life. It can sort of improve the quality of life in many ways, apart from the risks that it comes from. Do you see kidney disease more in men or women?
So actually, it's interesting that it's equally prevalent in men and women, but the patients who come forward are mostly men. So there's a huge gender bias, huge gender bias. Most men, they get diagnosed, they get treated. Women underdiagnosed. Though actually kidney disease, the autoimmune pathologies are much more prevalent in women. So we should be having many more women having kidney disease, but the gender bias is huge in India. I mean, going forward, if you look at transplants, the 70% of the donors is women.
Of the donors?
Donors. So only 30% women get a kidney, but 70% are giving kidneys. So usually it's a joke, and it's quite sad actually that the first transplant, first time the kidney is given by the mother, and second time by the wife. So I did my thesis on kidney transplant, and that's when we were really looking at all the donors and found that 70 to 80% of the donors were women. There was barely 20% who were the men giving the women.
I mean, that's life, no?
That is life, absolutely.
But do you think then that women, let's say post menopause, who suffer heart attacks or sudden death incidents, some of them could come out of undiagnosed advanced chronic kidney disease,
Absolutely.
which then have affected the heart and all that, if they are not actually diagnosing it?
Yes, it's highly under medical health, or rather health in women is not there yet. I think they don't seek help, they don't come forward for investigations until it's too late. And hence many times many patients who come in with sudden cardiac death, they could be having a whole a box full of medical multiple disorders,
which they haven't even bothered to screen.
Absolutely.
Which more men are screening now.
Yes, yes.
Okay. Your husband is also infection specialist at Rich Candy, Ruchi Samdani.
Yes.
This is doctor couple, and very often I find couples both are doctors, because they have the ability to understand each other's lifestyle and life.
Absolutely.
And make provisions for it. You have a daughter. Do you all just drive her nuts with all the knowledge that you have and all the prevention that you impose on your house?
So we try to be healthy. I mean, just seeing so much of suffering, lifestyle disorders, we definitely try to maintain a healthy lifestyle, and we would want her to be definitely healthy. And but we don't do any medical discussions at home at all. We keep our patients to ourselves. We restrict our patient conversations completely, because we both have different fields, and we have a lot of patient confidentiality also.
Oh, so you don't discuss cases
We don't
with each
discuss
other?
cases with each other at all. There is strict patient confidentiality, and we like it that way.
Yeah. But there's no doubt that when you and your husband enter a room, you're definitely the most sought after couple. And I hope you continue to be for many decades to come, for all the right reasons.
Thank you so much.
Thank you so much, Ruchi. Dr. Ruchi Samdani. I know that your career in nephrology is going to soar to incredible heights, and I look forward to seeing what technology does to enhance it as well.
Thank you so much, Devna. It was a pleasure meeting you today, and thank you so much for having me.
Thank you.